So now we will be calling our next guest that is responsible for nutritional dementias. So in this category, I will first like to welcome one of the greatest global impact factor nutritional deficiency that causes dementia, along with some interesting facts that will be when we talk with the disease we will come to know. So welcome Pellagra. Yes. Oh, there is itching going on and rashes. Okay. Welcome Pellagra.
Thank you.
Have your seat. Have your seat. Again, as a protocol, thank you. 1 minute, I will thank you for being getting okay. Okay, diarrhea. Okay, diarrhea. Once she gets comfortable, we will again start our podcast. Let us wait. Done? You're comfortable now? Little bit, at least little bit. Yes. Have your seat. Again, welcome. Pellagra, a big thing in this dementia conference. We have invited you, and kindly let us throw some light on yourself.
Thank you. Thank you. And bravo, doctor. It is time someone got me right. I am often misunderstood. I am called a rash that is blended with dementia and diarrhea. I received your invitation tucked neatly between a bowl of cornmeal and systemic neglect. I manifest when niacin runs out of your body and your kitchen is no longer making niacin.
Yeah, so niacin is the main factor. Because of niacin deficiency, all these things occurs. Okay, okay. So kindly, what is the epidemiology? What is your global impact factor?
Well, I have a global footprint. I am found in South America, Latin America, Asia as well as Africa. And I am found in chicken, turkey, tuna, peanuts, green peas. These are my major dietary sources. Niacin is found in all of these.
Yes. So if there is a deficiency from lack of these sources, somebody can develop pellagra. So basic is the niacin deficiency as you highlighted.
Yes.
Any other, what is the molecular pathology? Is there any molecular level you play, you game and all those things?
Yes, it's pretty simple, Niacin is the important vitamin here. I am also known as vitamin B3. I can drive a person mad when there is a vitamin B3 deficiency. It's basically your body forgetting the recipe of niacin. And I am like a bad guest that comes to your home when your pantry has run out of niacin or its precursor, tryptophan.
Tryptophan?
Yes.
Oh, niacin, then its precursor, tryptophan.
Tryptophan.
Okay.
Tryptophan could be busy making serotonin, Your body has to have its priorities right. I can come as alcoholism, malnourishment, carcinoid syndrome or Hartnupp's disease. I thrive anywhere where niacin deficiency occurs.
Yeah.
Niacin is a pretty big deal, Niacin makes NAD, that is nicotinamide adenine phosphate, nicotinamide adenine dinucleotide phosphate, which is its phosphorylated sibling. These are the energy currency of your cells.
Okay.
Your cell thrives on these energy coins. Without these cells, without these energy molecules, your body has no energy. The mitochondria starts to cry for energy. If there is no NAD, then there is no ATP. The gut cells, the cells of the brain, and the skin cells are high turnover cells. So these three go on a strike first. And that is when my clinical features enter the conversation.
Fantastic. You have made it so transparent, fantastic. So basically, when we talk about the clinical features, kindly highlight about the clinical presentations and all.
Okay.
You have fantastically enacted the clinical presentations for how the patients suffer, and you are so considerate that you have, for the first time maybe, you have painted yourself in the attire of yourself. I can see all these rashes. Kindly just show in front of the camera. These are the rashes you have seen.
This
And
is
what
me.
is this? The beautiful necklace you are wearing. What is this necklace? A very characteristic sign. Is it a characteristic sign?
Yes, I'm going to tell you about my
Okay.
dermatological artistry.
Okay. Kindly elaborate. We are very excited
Yes.
to see about it.
I manifest as a deceptive sunburn-like rash on the exposed parts of the body, as you can see. My forearms, the back of my hands, the neck, even the legs and the feet.
Even faces, face
Yes,
is like
these sun-exposed
Okay,
parts
okay.
are the first to get affected.
Okay.
Moreover, they become scaly, hyperpigmented and rough later on. I am also known for this beautiful necklace which sits like a symmetrical collar encircling my neck, and it was named after the keen-eyed Dr. Gabel Kessel, who in the 18th century documented my work for the first time. Much thanks to him.
Wow. So he's the artist who discovered this, huh?
Indeed.
So Cazel's necklace.
Yes.
Dermatitis rash, scaly rash,
That
sun
is me.
exposed areas, Cazel necklace.
Yes, sir.
Okay. And what about this podcast, as you know, is highlighted as a dementia podcast. So
Exactly.
can you please elaborate about your dementic thing?
Well, the poor brain, it gets affected, and as I deepen my grip, hallucinations occur, confusion sets in, and memories begin to fade. I affect the recent memory.
Recent memory, to be very precise.
Yes.
Okay, recent memory. Okay.
The patient has a lot of trouble concentrating and starts to forget the things, does not have enough power to memorize what he has just read or just studied. Then come tremors, delusions, and a haunting disorientation. I am an all-consuming disease, and I begin to stir the cocktail of cognitive decline vigorously when I do not get niacin.
Okay, fantastic. Okay. And the diarrhea part, as you have already cleared, the gut cells are also being affected, and because
Yes.
of that.
The gut is my favorite canvas, you see. I inflame everything from the mouth to the colon. I start to consume the colon and all the mucous membranes lining it. I am not just persistent diarrhea, you see. I am relentless purge that will strip your body of its fluids and electrolytes. I cause a lot of trouble.
So is there any way for the treatment? As again I have been highlighting this to my audience that there are very few causes of treatable dementias, and I think by God's grace and by niacin's grace you can be treated.
Oh yes, it's very important that you treat me, or else the fourth D comes into the picture, death. You can treat me by giving oral nicotinic acid around 100 to 200 milligrams thrice a day for 5 days, and I'll be gone with the wind, gone like a bad dream that is scared away by the dawn.
So is it like this instant after 5 days, or so you start to
Yes,
seeing the
I am a
improvement?
very treatable disease.
Okay.
It is important that you treat me, or I shall consume you.
Okay. Any other message you want to give?
The
To
message:
conclude? Any conclusion messages?
eat your nutrients right, or else I will come for you.
So hell niacin.
Yes, hell niacin.
Okay, thank you for your beautiful interview, and so crisply and so transparently to our audience you presented yourself with so much of dedication and so much of your dermatitis part and your knowledge, and obviously you have cleared a lot of doubts in our audience, and thank you again for coming to the podcast. Thank you.
Thank you very much. It was an honor.
Our next guest is again a nutritional cause that can cause dementia. And when we talk of nutrition, who can forget the great vitamin B12 deficiency? And especially when I don't go into the complication, making things complicated, let us start with the simplest. They attack the vegans. Later on, there are risk factors and all. Without wasting time, we will first invite our guest, vitamin B12 deficiency, and we will listen from his mouth how it affects the dementia part in neurology. Welcome, vitamin B12 deficiency.
Thanks for inviting me, sir.
Very good. Thank you.
Hi, I am vitamin B12 deficiency. I am today. I am explaining about vitamin B12 deficiency in dementia. My progression is subacute. I will attack from weeks to months, but my progression is subtle. If you diagnose me later, I will get worsen.
Again, the deadly message: pick up early and treat me early. If not, then permanence.
Yes, I will get worsen.
What basically is the pathophysiology? We already know. Again, you are a celebrity. We do see patients, and when I talk of vitamin B12 and neurological system, we already know that how great you are, and you can affect the peripheral nerves causing polyneuropathy, and you can also involve the spinal cord causing subacute combined disease of spinal cord, targeting the dorsal columns and pyramidal tract, spastic paraparesis and sensory ataxia, loss of position vibration. You are one of those rare scenarios where there we can get clinically ankle absent and extensor plantar. And we are here for the podcast of dementia part. What basically you do in the dementia part?
I have a cognitive impairment, like I mainly affect memory impairment, mainly recent memory, and I have a clinical executive impairment also.
Yes. Before that, what is the basic pathophysiology? What is the pathophysiology?
Vitamin B12 deficiency have a vitamin B12 has a great role in myelin formation and its maintenance.
Yes.
Like I am vitamin B12 deficiency acts as a cofactor for methionine synthetase, which helps in formation of methionine from homocysteine. The formed methionine helps in formation of S-adenosyl methionine, which helps in the formation of methylation reaction that eventually helps for myelin formation and its maintenance.
Myelination.
Yes. If my deficiency can occur, it will leads to demyelination of mainly dorsal column and corticospinal tract, and in decrease in the DNA synthesis and its replication, and neuronal death in brain, and cognitive decline and memory loss and dementia. And elevated homocysteine and MMA can leads to neurotoxicity and demyelination damage, and oxidative stress causes cellular damage that eventually leads to neuronal degeneration.
So invariably everything is happening because of vitamin B12 deficiency, yes. And basically it is the demyelination anywhere in the peripheral nerves, in the spinal cord and in the brain, with all your clinical features. Can you highlight about the dementia part, whatever cognitive functions?
Cognitive functions, mainly memory impairment.
Memory
impairment,
okay.
Like recent memory.
Recent memory is
Recent
important.
memory. Yes.
Recent memories to be highlighted.
Yes.
Okay.
And executive functions like organized problem solving, maintaining focus or attention,
Confusion
and difficulty in making plans, planning,
judgment, recent
yes.
memory, confusion, executive function and all.
And confusion and disorientation. And I have psychiatric features too.
Yeah.
I have a depressive mood, psychosis, apathic.
You can cause those neuropsychiatric manifestations also, apart from the memory part. So, are there any stages?
Yeah, they are. I am early reversible.
Yes.
You can treat me with B12 supplementation. I can be completely reversible.
Yes.
Like paresthesia, gait abnormalities, you can completely reverse me in early stages.
Yes.
In intermittent stage, like if you diagnose me late, I have a progression for pronounced memory loss.
Yes.
And difficulty in planning,
all
organization, all the executive
intermittent
functions.
stage, they
Yes,
all
the executive functions and gait abnormalities and everything. If late, it is like it is the worst phase. You can't even. It is irreversible one. It is demyelination and neuronal damage completely.
So
Yes.
that is irreversible.
Yes. Irreversible.
What basically is the treatment? You can just highlight it.
Yeah.
We all know.
Yes. The treatment is very easy, very basic. 1000 microgram once a day for 1 week, and followed by 1000 microgram once a month for 3 months, and once in 3 months for lifelong.
This is the injectable part.
Injectable.
That is the actual treatment. There are 2-3 other algorithms also. Somebody says that every 3 days give 5 doses or 6 doses vitamin B12 injectable, then 2 monthly, then. But this is one of the accepted protocol for treatment. And the take-home message what you want to give, if I am not wrong, detect
detect me earlier, so I can't affect you, and I will completely reversible. If you neglect me, I will get worsen and worsen.
We are doing.
You are
So are you advising us to take up non-vegetarian meals?
no. You have a lot of options in vegetarian too. You can have green leafy vegetables, which
Milk
I am
and
rich
milk
in
products.
milk products.
Like, yeah. If somebody
products,
is starts
yes.
stung vegetarian,
Vegetarian.
he should not have
Yes.
the milk products and all. Thank you very much.
Thank you so much.
Thank you very much. Our next guest who causes dementia is from the endocrine family, and it is a very well-known entity. It is a very well-known entity. It is hypothyroidism. Let us welcome hypothyroidism, which can cause dementia. Welcome.
Hello, sir.
Welcome. So we all know that you are hypothyroidism.
Yes, sir.
And before I talk, the world knows it is a clinical diagnosis. And can you just say 2 words to our audience?
As the world knows, I am the best. I can be a best spotter.
Oh,
for diagnosis.
fantastic. You can be a spotter.
Yes.
You can be kept as a spot diagnosis for our undergraduate students and postgraduate students. They will diagnose you from a distance.
Yes, sir.
By what features? What are the common features? Just to revise memory recall for our audience.
Yeah. Well, I come along with the symptoms of weight gain, generalized weakness, fatigue, constipation, dryness of the skin, hoarseness of the voice, cold intolerance, delayed deep tendon reflex due to myotonia, and there is a also important sign causing lateral 1/3 of the eyebrow thinning, known as Hertoghe sign.
Hertoghe sign. And you have already talking about the clinical features, that is the clinical signs. Apart from these clinical signs, you told about the neurological signs, that is myotonia, delayed relaxation of the deep tendon reflexes, especially elicited in the ankle. And also, I know that you also involve the proximal girdles.
Yes, sir.
You can also cause myopathy.
Yes.
And on general examination, we can have a bradycardia, like
Bradycardia.
decreased pulse.
Yes.
Okay, fantastic. But in this podcast, you are being called for the dementia part.
Yes.
Can you highlight on how you affect the brain and cause dementia?
Yes. So hypothyroid, there is a low level of thyroid hormones that will lead to decrease the cerebral metabolism, decrease the oxygen and glucose utilization in the brain.
Because of decreased metabolism.
Yes. There is also decrease the cerebral blood flow, leading to cerebral edema and confusion. Also, there will be alteration in the neurotransmitter activity. Neurotransmitters such as serotonin, dopamine, and noradrenaline that will lead to alteration in the mood, memory, and the attention part.
Attention function.
Yes, sir.
And maybe with your permission, your most closest AD, which does everywhere all the things, that is the glycosaminoglycans. Maybe they are also getting affected.
Yeah,
deposited in the brain.
there is an accumulation of the glycosaminoglycans in the brain.
Okay. Like this, you can cause this type of symptoms. And
All
dementia.
this, yes, sir. All this mechanism will cause dementia-like symptoms of memory loss, poor concentration, depression part. Yes.
So, how can we diagnose you? Can you
Well,
just-
there are many of the evaluation.
First
First
clinical.
is
We talked about the
clinical.
clinical part.
First there is clinical.
Yeah.
Second is biochemical by sending thyroid levels, TSH
Yeah, of
and
course.
free T3,
Of course.
TSH.
TSH level will increase and
Increase.
T3, T4 level will be decreased.
Yes. Also by brain imaging, there will be diffuse cerebral atrophy
Okay.
and changes in the white matter also. And there will be EEG on electroencephalogram. There will be diffuse slowness of the electrical activity, leading to diffuse cerebral atrophy.
Slowiness, acha. That means those electrical EEG waves, the slow wave EEG findings can be there, like
Yes.
theta waves and delta waves.
Yes, sir.
Okay. So diagnosis is done. You have talked about the neuroimaging part, cortical atrophy will be seen. Treatment.
Well, I can be reversible. I am the reversible cause
Again,
of dementia.
Thank you for being reversible.
Yes,
Yes.
And by giving thyroxine hormone replacement therapy, I can be reversible in weeks to months. But if there is a delay in the treatment, I can lead to permanent cortical deficit.
So that is the important finding. Early diagnosis should be there and early initiation of thyroxine replacement. If it is neglected, maybe the cerebral part and the memory part won't return. It will be permanent memory loss. So the key message was early treatment, early diagnosis of thyroid hypothyroidism, early initiation of treatment so that thyroid dementia we can prevent and treat. Thank you, sir.
Yes.
Thank you.
Thank you.